Good afternoon to you, our viewer. Thank you for joining us on Riverside TV. Welcome to yet another episode of Doctor's Call, where we'll discuss all matters health. We have been doing a series on mental health, and I think it's important for us before every episode to remind ourselves, why do we do mental health and why is mental health important? I'm joined today by our resident Dr. Yvonne.
Thank you.
How are you?
I'm very fine, thank you, Gladys.
Okay, we are reminding our viewers why we do this every week. Why mental health?
Yes.
So kindly.
All right, my name is Yvonne. I introduce myself as a mental health advocate. I also in charge of seeing patients. When it comes to mental health, it's something that I'm passionate about because mental health is something that, unlike the normal disease that we used to treating, mental health is actually unseen, and it can only because it actually happens in the brain. And you find that when your brain does not work properly, we have things that do not function well. Let's look at a few functions of the brain. The brain is used to perceive.
Yeah.
The brain is used to think. The brain is used to move your muscles. The brain is used to help you interact with other people. So you find that when something is not right when it comes to your brain functioning, most of the time can be even maybe a hormone or an enzyme or a neurotransmitter that has an issue. You find that all the systems in the body do not work. Okay. And unfortunately, when such a thing happens, we find that as the problem progresses, people tend, the certain symptom becomes now a disease and eventually a disorder. Okay. And in doing so, you find the person now is unable to perform properly in the society. You see, in mental health, we want people to have good mental health because in good mental health, the person is productive, the person can relate properly, and the person actually contributes to the society. And that's what we need. So that is why we talk about mental health, and we say mental health is your wealth and there is no health without mental health.
Yes.
So yes.
Okay, dear viewer, last week we discussed about ADHD, which is attention deficit hyperactive disorder. And this week we are going in case you missed that episode, you can find it on our YouTube page, Riverside TV Kenya. This week we are going to discuss a disorder known as OCD. So Yvonne, before even we begin to describe it, the full meaning of OCD, what is it? Well,
first and foremost, you have to understand that OCD is Obsessive Compulsive Disorder. And the obsessive is, for example, let's just give it a small pinch so that people can, our audience can actually understand us. Obsession can be anything. And when someone is obsessed, the idea is in their mind and it can't go away. And then we have the compulsion. The compulsion occurs when there's an obsession. The compulsion to do something, it's a repetitive thing. So, and then of course, if it occurs for some time, we start with a certain symptom, and then of course it progresses such that it hinders you from normal functioning. So we'll discuss the things that the obsession can do, the things that the compulsion can do. But a brief, just to give it, I'll give you examples as a good teacher, right? So for example, you're feeling an itch on your face or your cheek. So when you feel that itch, you feeling the itch. When nobody can tell you, can you see the itch? You cannot see it. But when you now scratch the itch, when you're scratching it, now that's the compulsion because there's something you're doing to the itch. But someone can tell you there was nothing. It's a mental health actually. When you put it that way, it's something that only someone can tell you what they are going through for you to understand what is going through them. Okay. Yes. So that basically that's the obsession part of it. You feel an itch, and then you sometimes, even if you don't scratch it, the itch goes away. But sometimes you feel an itch, you just want to scratch, but if there's nothing that has bitten you. So we want to talk about now that obsessive compulsive disorder and why we need to know about it, why we need to manage it, and let's remind our viewers it is treatable. Yes.
Okay, Yvonne, so firstly, we need to understand who is likely to get OCD.
All right. You find that in OCD, this is among the few conditions where you find male and females get it equally. Well, let's say so anybody is at risk of getting it. And of course there's an age they talk about, from 18 to 35, dependingly on someone. And of course that's basically what we have. But as usual in Kenya, we don't have statistics. We are reliant on statistics abroad in the developed countries, but we are hoping that we can also be getting our own statistics, as well we can help people. You know, it's a continuous development in mental health.
Okay.
Yes.
So what causes OCD?
Well, okay, some from the records and actually research find that it can be inherited. You find that certain people in a family, they tend to do things in a similar way. Of course, apart from being inherited, when you live in an environment where people have OCD of various factors, you find a person will actually even adapt to the environment. When, like you see, we have schools, there is a lot of discipline, and we are taught, let me say, the non-schools.
Yeah.
Those ones, the order, everything is in line.
Yeah.
You adapt to it.
Yeah.
And some people, that one is a good to be neat and organized. Some people might now, due to the illness in mental health, they might actually adapt, and it becomes now a disorder. They become extra on it. Everything in mental health, these symptoms occur to everyone, but it becomes extra. That's when it becomes a disorder and it bothers the person's life. Of course, people can get infections. For example, someone gets, we are not scared of corona. Right? I remember when we started, we were told, your clothes leave at the door, go to the bathroom so you don't spread the corona there. So that idea was planted in our brains, that corona is everywhere. You might be carrying it, but you don't have it, so you leave your clothes there. So we did some of these. These are compulsions, or for the fear of the infection. So if someone who's gotten corona will wear even 3 masks.
True.
You see now?
Yeah.
So that's why I tell you, sometimes when you get an infection, you're so scared to get infection again. You're like, this one, it's now become, no, you're supposed to live life freely. But now you have to be trained, no, wearing 3 masks is even not safe for you.
Yeah.
So those are the things we're trying to talk about. And of course, the last thing is the stress. Stress is a lot. And we'll understand how stress comes in time when we talk about the obsessions and how the compulsions can come by.
Okay.
Yes.
So Yvonne, I'm sure OCD manifests itself through various signs and symptoms.
Yes.
So what are these signs and symptoms?
Well, when it comes to signs and symptoms, well, that is when we describe the OCD in length. And I'd like you, I'm sure before the show, let's tell our viewers, we discussed what you thought OCD was.
Yes.
And what did you tell me it was?
I thought it was being excessively clean. Yeah.
That can be a source of OCD. Let's remember, we have the main called obsessions. They're like 4. The first one is the contamination. But let's also tell our viewers of something else. Obsessions are unwanted images, thoughts, feelings, or impulses. They are unwanted. Nobody wants such thoughts.
Yeah.
And that is to start with. Then the other common symptoms we have is contamination. So you find that I will come, I will not even open the door.
Yeah.
I'll tell you, hey, Gladys, could you kindly open the door for me?
Yeah.
I don't want to be contaminated.
Yeah.
Some people even wear gloves because they don't want to touch people with their hands. Before Corona, people would even say where we fellowship, people greet others as sign of peace, sign of peace, handshakes. But you find that people would, in people's minds, some would be like, maybe they never wash their hands properly when they use the toilet, maybe they use their hands to blow their nose. You imagine people touched money in a butchery. People start having, you see, these are unwanted images. You just start imagining the worst thing that can ever happen to this thing.
Yeah.
So that is the unwanted image of contamination. Like with Corona, at the moment, we are just living by God's mercy. The contamination can be anywhere and everywhere.
Yeah.
But there are levels that people have. We have, before we started with the extremeness, but now we have relaxed. But we are trying to adapt and understand the condition better.
Yeah.
So that is one. Contamination. It's an obsession.
Okay.
And remember, it's unwanted, because the images you have in your head, they're not healthy.
Okay.
Then the other one we have, it's doubts. Doubts, for example, you walked out of your house today in the morning, and when you walked out of your house, did you lock the door?
Yes.
Are you sure?
Yeah.
So you find that a person who has the excessiveness in doubts, they'll sit back and say, did I close that door? Did I? Can I call someone to come up? The door is locked. You see now, wherever you are, you're at work. You're supposed to be working. There's work to be done. But you're thinking about the door that you might not have closed.
Yeah.
Something happened to me last year. I was doing a certain program, and it was strenuous. And when I'd be in the hall, I'd sit and wonder, did I turn off the gas stove? Because there's something I used to cook every day in the morning. Then one time I said that, but then the house has a history of fire. So I was like, in case I didn't turn off the gas stove, if they'll see smoke, they will give me a call and tell me I left the gas stove on.
Yeah.
So you're going through stressful moments. But you're in the hall. Remember, you boarded a matatu or a vehicle. You went, you reached your destination. The session started. But now, when you're sitting in the hall, you think about the gas stove that you might have left open, and you're like, these are the doubts that come in. See, they are unwanted thoughts, images, impulses, even feelings of doubt. Okay. Then, of course, with that, we have the other thing. It's called order. With order, you find that there are people who are extremely organized. I fail in that department of organization. I am clean, but organization is an issue. So these people, like for example, I put my pen. Let me give an illustration to our viewers. On this is the position of the pen.
Yeah.
If you move it, I come back. I will notice it is not in the position I put it at. So I will turn it the way it was.
Yeah.
That is the order we're talking about.
Yeah.
When you put something like a cup or a flask, if you alter it, there's a way people set up tables. You know how people set up tables? They set cups, spoon, tools. It is okay. It's good order. But there are even angles to the knives and the forks. These are things I have no idea about. And the thing I've noted, I have a friend who's organized. Yes. So one time, I've been to her house so many times for over half a decade. One time she told me, you don't put the soap right. In my head, I'm thinking, there's a soap rack. So I was like, what do you mean? Then I was told when you put the soap in horizontal way, it issues a rack. So I was like, you should put it in a vertical way. In my mind, I was like, I've been in this house for over 5 years. Has she been having this problem with me? It's just that unconsciously I put it the right way. So you find that these are people we live with, and these small things, they bother them. But the time they tell you put the soap the wrong way, it's quite an effort.
Yeah. So
you find that these are not things that are just in books; they are happening around us. And that is the type of order. Extremist. Because soap is soap.
Yeah.
Can you put a cup this way, cup that way? It's a cup on the table.
Yeah.
We are, of course, there's a normal order, but even the angles. The people even, actually people go to extremes of even using protractors to make sure everything has maybe a 90 degree or 60 degree. It can be that bad. And that's why we talk about mental health, because you find this person cannot live a normal life. They are hampered by their unwanted images. Because for them, when they see that, they see as if there's a disorder. There's a wreck in the system completely, and they'll think about it the whole time. And you find that they'll even fidget because they just can't stand seeing that thing as it is. They just want to go and put it as the angles that they feel is balanced.
Yeah.
And that's why I say it's treatable.
Sure. And
people should seek help.
Yeah.
Then there's another type of obsession that, of course, we do not know of. And I've encountered it sometime. We know when we talk about mental health, we talk about there's crime, there's sanity, and there's evil. There's evil and sanity. Yeah. And people normally have to understand. Some people do things that they just claim it's they're mentally incapable. Yeah. Now the other obsession is violence. Yes.
Okay.
And this one is tricky because you see this person has an unwanted image or a feeling to cause havoc, to cause fire, to just beat up people on the street. Not because they want to beat up, they're just obsessed with beating up and see them cry. There's chaos, they're just excited by that. Trust me, it can be an illness. So when you see violence, please keep away from violence. You don't know what's going on in that way. You don't know what caused it. You don't know what's going on. Please keep off. Yeah. Because someone might be unwell, and that's why they're causing the violence. Yeah, okay. So you need to understand violence also is part of it. It's a very unique one. So I think that's why everybody, if there's any violence, people have to go to a court of law and they are assessed. You see, we need to be actually judged. You have the intent, and you did it. Yeah. Yeah. So those are things that you can look at.
Oh, that's why they check to confirm if you're okay mentally.
Yes, because if at all you're having a problem with an obsession with violence, you just, in fact, there's something, I normally watch a lot of documentaries when it comes to security and, let me say, crime. And you find that there's a person who was committing murder, that is violence. On the basis that the person is wearing a red outfit or something red, a red hat, a red sweater, a red outfit, whatever. As long as the person sees something red, it used to excite his violent urges. Yes. So this person, if you're any other color, they won't even notice you. Just wear it. That is it.
Okay.
So that's an obsession. Unwanted images, thoughts, feelings, or impulses.
Okay.
Yes.
Okay. Dear viewer, I'm sure you've heard what Yvonne had to tell us today. Stay tuned. We'll be right back after a short break where we get to learn more about OCD.
Music that uplifts your soul, that makes you wanna dance and worship your living God. It comes to you on every Friday, 9:30 to 10:30 p.m. Worship and cut.
Nafanya bidii nijenge nchi na nijijenge. 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 Hii ni bidii yangu. Oh, I just wanna work down with you. I'd be selfish, but I just can't.
Welcome back, dear viewers. Remember, you can follow this conversation on our social media pages, Riverside TV KE Facebook, Riverside TV Kenya YouTube. Now, before we went for the short break, we talked about OCD. We talked about the obsession part of OCD. Now that we're back, Yvonne, we'd like to talk about the compulsion part of OCD.
Oh, yes. Gladys, thank you very much. We find that OCD has the obsessive, then there's a compulsive part, and make it a disorder.
Yeah.
So you find that in the compulsion, you find these are repetitive or persistent behaviors that people do. And the reason they do these behaviors is to allay or reduce the anxiety that the obsession is causing.
Okay.
Let us remember, I feel like scratching my cheek.
Yeah.
But if I don't scratch it, the itch will just go away. The feeling will go away.
Okay.
But if I have a compulsion, I will scratch it.
Yeah.
And then I'll feel another itch somewhere else. Remember, the obsession is unwanted.
Yeah.
So I'll continue scratching the whole place and even maybe injure myself.
Yeah.
In the idea that maybe I'm having an itch. I'm imagining itches in
Yeah.
my body.
Yeah.
So compulsion is a repetitive and it's normally a response to an obsession. So there are several. I'll do the common ones.
Okay.
So that we can relate them with the obsessions that we actually discussed. And you remember the 4 types that we had was contamination, doubts, we have order, and the violence.
Yeah.
So we find that, let's use our COVID, because before COVID things were all normal and people had issues with OCD. And this, for example, we find people washing. It's good to wash your hands. We are advised to wash your hands before doing this, after doing this, all those things we do.
Yeah.
It's good to wash your hands. But you find that someone might be washing their hands often in a way that almost doesn't make sense.
Yeah.
Because they have the obsession of contamination.
Yeah.
We use money, cash money.
Yeah.
You imagine this money was in a butchery, it went to the toilet, it might have fallen, it was picked, it was on the ground,
Yeah.
it has collected even the anthrax, and, things, especially if you know these organisms, you think about them throughout, or if you've experienced them close to you. So you find that the person will actually be washing their hands even after touching money, after everything, not even before eating. Then of course such a behavior, even if they can even be sanitizing. So you find that this person cannot have peace, because even this pencil, if you touch it, I'll have to sanitize it, because I am scared, I don't know what's in your hands.
Yeah.
So that's why I say it makes you not have a productive life. Of course, it responds to the obsessions of contamination. We have the ordering one. The person, as I said, the obsession is this thing is not in a good angle, and to them they have the compulsion. They want to make sure it is in line. They'll come here and they'll disarrange the whole studio, because it is chaotic, and when it's chaotic in their minds, there is no peace. Until that thing is organized, there'll be no peace.
Yeah.
And of course, you understand, in this world, unless you're living in your own world, it is difficult for you to have everything done as according as you wish. That's why I say treatment is available, so that you stop having the images that are making you have the compulsion. Right? Then of course there's another one, the compulsion. You're like, Gladys, do I look good today? Am I smart today? There are people who just want reassurance, not because they have low self-esteem, it's because they have doubts. They don't think my hair is not good today, I don't think my outfit is fit today. So these are people who need to be reassured on and on, because you find that it's a repetitive thing, because they don't have self-esteem, but eventually the self-esteem will go low, because they're not confident now. But in their mind, they have the image of they never look good enough. They never do something to completion well enough. So they need to be reassured. You did a good job. Somebody might think you just want to nag people, but my dear, you run well.
True.
Yes, and it happens a lot, and even it can even impact on performance in schools, and even work performance and of course workplaces. So because the problem has come up, and remember the causative agents, stress is one of the factors, and of course the environment, because you've gone through the same thing. The other one is repeated actions. We find that this person the actions, you see, like the person will always be repeating the same thing over and over again. If it is washing hands, they'll wash hands. If it is setting up plates in a certain way, they'll do, it's something they do through and through. And if you visit that house, you move a seat. If you move the seat, you find that the seat, they will have to come and put it back again.
Yeah.
You almost think something is wrong, but to them, they feel okay, they are comfortable in their own spaces, but spaces around other people, of course, that's when you find that people may even have issues with isolation because they're not able to integrate with other people in the community properly. Okay. The other thing is counting as a compulsion. And counting and repeated counting, you find that a person, counting and repeated actions, you find like a person who's having an obsession with violence. To take away the violence, one of the repeated action is they will tap. They will tap a surface, they will tap a floor, they will drop a ball. Okay, we used to have yo-yos in our time. They will do the same thing over and over again to take away the violence urge. And the counting also, they'll also count if they feel like going to hit someone. They'll count backwards from 10 to 1 so that actually they can be able to, by the time they are thinking that by the time we are done, the counting, the idea is gone because they know it's not normal. But now when you see you're trying to control the obsession through a compulsion. And of course we have our usual, the check-in. Did I turn off the gas stove? Did I lock the door? Did I put everything? Did I turn off the tap? If the water comes, if the water was not there. So that is the obsession of doubts. Yes. So you find these are the common ones. But to most people, to look like it's normal, but when there's a level of extra in it, that's when you start saying, okay, I think there's something here that we need to check with our healthcare providers and get solutions. Yes.
Okay, Yvonne, is there a treatment for OCD?
Treatment. Let's say mental health is a great thing because anything that has a problem in this world, we are able to treat. And of course, there is treatment. And one of our usual treatment forums is the cognitive behavior therapy. And it's broken down into 3 things, which is specific to OCD. The first one is psychoeducation. In psychoeducation, you find that this person, when you do diagnose with OCD, okay, it goes with any mental health condition. It's a shocker. Then you start going back and thinking, no wonder I did this thing. So the person, the first thing, of course, they're given the education. They are told, this is an obsession, this is a compulsion, you've been doing 1, 2, 3, and as a result of this, they help the person who's treating them, the psychotherapist, will be able to relate the condition and tell them how they are. The next thing is still part of cognitive behavior therapy is cognitive restructuring. Cognitive restructuring is a fancy word for saying we are changing how you think. So you have these images. Is there a way we can change how these images are? The images, the feelings, the thoughts, and the impulses. Are there ways that we can counteract that? And of course, that is now part of it. Then, of course, the last one we have is exposure and response prevention. Exposure is whereby after a proper education, after proper restructuring how you think, of course, the exposure is when we bring the impulse, we put its order, we put things in a disorganized way, and you are tasked in saying how you feel about the situation. Of course, the exposure comes after the psychotherapist, not to torture you, comes after the psychotherapist actually understands that we can do this now because you need to be integrated in the normal society. Because with other people it will be difficult. So that is the cognitive part. And as usual, dependingly on the level, we have medication, non-serotonin reuptake inhibitors. Those are big names for the chemicals that can actually help, because they actually help with the neurotransmitters. Because of course some of these things are just neurotransmitter disorders. And of course the other thing, of course, you have a good follow-up in the clinic and also a good support system. Yes. Okay.
Well, dear viewer, unfortunately we have run out of time, but I'm sure you've learned a lot about OCD and you're able to assess whether it is actually normal or whether it has reached a point where it's a disorder. Join us for this and more on our next episode. Until next time, I have been your host, Gladys Mumbo.